Well, welcome to the Institute for Strategic Policy Solutions. We are so honored to be at a different college. For those of you all who don't know us, our virtual audience in particular, we are a think tank embedded at St. Petersburg College for the benefit of the Florida college system and the gift of former Congressman Bill Young, who served our state gallantly to make sure that there were resources to educate future public policy leaders and students in general about what lays before you. So in this case, because we thought it appropriate with the titanic shifts that are going on in the community, that we would focus on nurses, because nurses care. I'm going to take just a small point of privilege because my mother is staring at me. My mother is a nurse, and she has been a nurse for 60 years and has been in all areas of nursing, so I brought her with me. But I also want to take time to thank our team, including our tech lead, Kyle, who comes to every program around the state, our statewide coordinator, Aaron Bryce, who is next to me, our lovely photographer that you'll see everywhere, but he's not a photographer, he leads all of communications, Matthew Lee, my associate director and comrade, Sam Jenkins, and outside, the lovely new addition. His name is Michael Ballard. He is a student, and he worked really hard to get you all in here safely. So we hope you enjoy the program. Please use those note cards to ask a lot of questions, and we're excited to hear your thoughts. And with that, I'll leave it to my colleague, Aaron Bryce.
Thank you so much, Kim. Welcome, everybody. We're very glad to have you today. I have the distinguished pleasure of introducing our esteemed panel today, and I've had the pleasure of working with them as we've gotten closer and closer to this day. And while they have quite robust biographies, I'll go ahead and just hit the highlights for the sake of time. But our moderator today is Dr. Tammy Sawmel, who's a Dean of Nursing here at State College of Florida. She has over 20 years of experience in both academic, program development, accreditation, and regulatory compliance. Additionally, we have Judy Young, who is a position of Chief Nursing Officer since 2014 at Lakewood Ranch Medical Center, and most recently at Manatee Memorial Hospital. She has 38 years of experience as a registered nurse as well. And then we have Dr. Louisana Lewis, who is a trailblazing psychiatric nurse practitioner, as well as an academic leader and advocate. She's the founder and CEO of Prestige Health and Wellness in Tampa, Florida, as well as serves as a chair of the board of directors for the Florida Center for Nursing, so a wonderful statewide presence that we're very glad to have here today. And then we have Stephanie Sharp, who is the Director of Operations for Clinical Learning Development and the Hospital Care Team at Orlando Health Bayfront Hospital, also with over 22 years of a nursing career. So again, give a round of applause for such a wonderful panel we have today. Thank you all for being here, and enjoy the program.
Thank you. Here we go. Good afternoon. Uh-oh, let's try it again. Good afternoon. Good afternoon. Awesome, there we go. I want to begin by thanking our State College of Florida Level 1 students. Raise your hands. All right. And our Level 4 students, who will soon be out there as nurses. Thank you, guys. For being here today, your participation shows your commitment to learning, growing, and preparing for practice. The insights you hear in this discussion will not only guide you as student nurses, but also serve you well as you step into your future roles as registered nurses. I would also like to thank our non-student audience, including faculty. Thank you for coming, Dr. Rand and Dean Tracy. And I encourage you to share your questions as they will help us to better understand interest and the desire to learn. A heartfelt thank you goes to our panel members for sharing their knowledge, experience, and expertise. Your contributions strengthen our nursing community and inspire our students to see the possibilities ahead. Finally, I want to extend an appreciation for ISPS for organizing today's event. Your support makes opportunities like this possible and ensures our students are continually connected to real-world perspectives. So let's take what we learned today, carry it forward into practice, knowing that every conversation like this helps to shape us into stronger nurses and leaders. So are we ready for question number 1? All right, let's do it. Back to page 1 before question number 1. Very good. All right. Given the predicted growth of the registered nursing profession, how can the nursing workforce adapt to meet the growing demand while maintaining high standards of patient care and staff well-being?
I never mind starting first,
Perfect.
right? But a little shameful plug, it's not shameful because I represent the Florida Center for Nursing. So our nursing students, I encourage you to plug in. If you have not, the Florida Center for Nursing was established to research and address issues of supply and demand for nursing, including issues of recruitment, retention, and utilization of our nurse workforce resources throughout the state. So this was a government appointment that started after COVID. So plug in, know what's going on within nursing throughout your state, and you can definitely look it up on it everywhere and follow us on social media. Now, when we just produced some of the reports, and the report highlighted not only our registered nursing profession, but also nursing in general, including our LPNs, looking at our current workforce projections. And this was projections for 2022 to 2037, which shows that we will be short nearly 20,000 RNs and projected to face a 57,000 nurse shortage by 2037. So when you think about growth for nursing, there will always be growth. Now, the next thing is, how do we meet the demands? I think our beautiful state of Florida has done a wonderful job since 2020 in turning around how we have recruited, retained nurses, our not only the academic partners, but also our clinical affiliates, our hospitals that a beautiful lady sitting beside me have done such phenomenal work in ensuring that space is provided for our nursing students, and also that you get the right training and able to retain, right? So I'm gonna stop talking so that they're able to share their wonderful knowledge alongside with you. But if you want me to say anything about well-being, I am honored.
I'll just add in, so that was a great lead-in with retention. So it's our responsibility as hospital leaders and nursing leaders to listen to our staff and for you all to have a voice. And it's just so important because it's a two-way street that you all have to be happy with where you're working and engaged with where you're working. And when you have ideas for how we can do things differently, we definitely need to listen because things are changing all the time. You all are, you're learning in your careers and you have goals, and the things you want to do now may be totally different than the things you want to do in 5 or 10 years. And it's our jobs to listen and to help you get there. And when you don't want to work a 12-hour shift and it's Christmas, you know what? Maybe you split shifts. Maybe you come up with different ideas because we can do things differently. We want to make sure that you have a life outside of your job because that's what's going to help you stay at our facilities working. We want you to stay clinically engaged. If you don't, we want you to find a great job, doing other things. But nursing is such a great career where you can do so many different things. So what I hate to see the most is somebody getting out of nursing completely because the possibilities are endless. There's always going to be a job, and I would just encourage you to always have a voice with the facility that you're working in with your leaders. If your leaders don't want to hear your opinions, then you may need to switch to different leaders so that you can have an area that you are actively engaged. Sometimes things don't happen overnight, but having somebody who's listening to you and helping you make progress is such a huge thing. So always remember, your employers know that you should have a life outside of your job. So make sure that you do that. You're going to be entrenched the whole time that you're at work, but you need to be able to stay mentally healthy and make sure that you take time for yourself to learn and grow.
Hopefully this is on. Hopefully you can hear me. My caveat to that is there's never a bad time early in your career to get into shared governance within your facility. When you are interviewing for a job, I really strongly urge you to ask how your nurses are included in the decisions that are going on and happening in your facility, simply because one of my favorite phrases is the people who are closest to the problems are closest to the solutions. And you may be early in your practice, but you are very in tune with what works with your workflow, what doesn't work, and you have to help bridge that gap. Many times in your first year or so in practice, your head is spinning so much and you can't think of spending one more minute in your organization sometimes. But I advise you to really try to make that work for you, because you will find so much solutions and so much joy trying to be an assistant to trying to solve the problems that you see every day in your work life. So.
Thank you. All right, on to question number 2. Thank you for that. That was great information. What strategies can colleges and nursing schools implement to encourage experienced nurses to transition into educator roles, and what are the potential barriers to this shift?
I can start with that. I think it's really important to identify the right people for it. Some people naturally gravitate toward educating. They become your great preceptors. And I think you've really got to grow them when you identify it and help them see the big picture. I became a leader because, I love taking care of patients, but I felt like I could influence the care of more patients and make care safer for more patients by becoming a leader. And I think that people who gravitate toward education encourage that, help them grow and bloom, and make sure that they have the connections that they need. Some of them start out as preceptors, and then they grow into education departments, and sometimes they want to come to the schools and be clinical faculty for the schools. I think encourage it. They sometimes work full-time job at the hospital, and they do faculty at I forget, I'm probably saying the wrong word for that, but they work in the hospitals with the students and do that at times too. So it's a great balance. It's a great way to keep up with clinical standards, but also have that education experience as well. And I encourage it. And identifying the right people early on is very important too.
For me, I really think that it's very difficult to jump into an education role, both feet. Oftentimes nurses do just kind of want to try it on for size. So many times if you are very passionate about a particular topic, whether it be sepsis or heart failure, something that really intrigues you, perhaps you went to a conference, or maybe you're doing more in your program where you're having to do some kind of project, and you want to bring that back to your team, try something small to begin with. Do a small presentation and see how you like it. See what your tone is like. See how nervous you are. It's really different to do it in front of peers versus strangers. So try things on slowly, and then maybe you might have a real knack for it, and then people will start to pull you into other things that may be within your wheelhouse.
And we know that Florida data shows that there has been an increased enrollment across all different nursing programs at various levels of education, whether it's at a technical college, associate college, or university. And what's happening is that with the increased enrollment, nursing educators are needed. And I know one of the questions were about potential barriers to that. One thing that Florida Center for Nursing has done is that we created a course that has been on the website to educate nurses about the steps in becoming adjunct faculty. That is where you get your feet wet, right? Where you can share your clinical knowledge and kind of garner that passion, so that will lead you into seeing that, is this the right move for me? But the other things that I probably want to highlight in the question, Dr. Sawmel, is we know best about this part are the barriers, right? And I'm not going to be speaking from my FCN role right now. I'm going to speak from my ex-dean role for nursing. I was the dean for St. Petersburg College of Nursing for several years. And that was one of the struggles as a dean that we have, was not only recruiting, but retaining faculty. And there are various reasons, but some of the highlights is that we cannot compete with the clinical world as far as salary. You know, nurses and, faculty members need to make the salary needed to support their families. These are master's prepared level faculty members. So that was definitely one of the biggest barriers. And through the funding that the state offered, of course, I was able to use that to support faculty. But another thing is that I know you students see your faculty, 8 of you to 1 of them in the clinical setting, right? 40 to 50 of you in the classroom. So you can only imagine trying to pour all that knowledge into your 50 beautiful brains, right? It's a lot of work for them. So we have to find ways to support them, because faculty also burn out.
I would agree with everything you just said. It's a big job that faculty have, and to keep them doing what they need to do is really important. Thank you. All right, in light of increasing numbers of patients who report feeling disconnected from their care providers, how can hospitals improve continuity of care, especially when patients have multiple nurses throughout their stay?
Okay, for me, this one is one of the ones that I'm extremely passionate about. So it's so important for patients to feel connected to their caregivers, but also for the caregivers to feel connected to their patients. That is what makes us want to do what we do as nurses. So one of the things that I find, and sometimes it's a little tough to get people in the routine, is really when you do your shift-to-shift reports, to do it with the patient at the center of it. We've kind of come with our hospital system where we're kind of doing a half and half kind of thing, because sometimes nurses don't feel as comfortable giving their whole shift report in front of the patient. So we're doing part of it outside of the room with the patient, and then going inside and really talking to the patient, engaging them, talking about their plan of care, making sure they know what's happening with them and what's going to be happening with them. And, we're trying to simplify it and saying outside of the room, it's about the nurse. Inside the room, it's about the patient. So it's one of those really great things to really engage in, and it makes the patient feel important. You know, when we're in the room, we're talking to you. We're talking about you too, but we're talking to you. We want to know what your questions are. We want to make sure that we're checking your IV site and your pump and, all the things that have to do with you and answering your questions. So I think that's probably the very biggest thing we can do to make sure that the patient feels safe, that everybody feels connected. And I think the other thing is interdisciplinary rounds, so that we're, if we can round with the physicians, we should round with the physicians. They love to teach, most of them. So they love to teach. So I know everybody's super, super busy, but if you can get in there with a physician, you are going to learn so much about the patient, and we're going to come across to the patient as a team. And that helps them feel engaged, and it helps us all feel connected, and we know what's happening. And then when the family members come in, we can tell them what's happening with the patient if they don't remember. So those are a couple of the things that I feel are very, very important with that topic.
I love this topic. I feel very, very strongly that there is an art to connecting with another human being. When you are a caregiver, to me, there is nothing more important. You practice for 4 years on being a nurse. You've had 4 years to hone many of the skills to be a nurse. you should also use that same energy to connect with people. When people are in a care setting, they are vulnerable. We have taken just about every shred of control away from them, and we have expectations that they're just going to accept it. They don't have pants on. They eat when we tell them to. They take the meds when we tell them. They sleep when we, hopefully do all the things. And it's very, very daunting to be vulnerable in a setting with strangers. So making a connection with people is paramount. Being able to show body language and eye contact that actually shows that you are interested. Everything in our world today gets in the way of making connections. Every phone, every computer, every screen gets in the way of actually making a connection with another human being. And we're very used to that. And sometimes it can put barriers in place that we don't even realize because it's an everyday occurrence. So you have to actively learn how to connect with others. So that to me is my soapbox, but. That was a beautiful soapbox. Thank you.
As healthcare facilities face staffing shortages, how can there be increased support for sustainable solutions? And are there any new policy initiatives that could help address the nursing shortage?
That is you got it. All right, go ahead.
I actually had to do some research on this because nothing popped into my head right away. But in January of 2025, we have an Arizona and a Tennessee representative who are bringing a Precept Nurses Act into play where they want nurses to precept, and they're trying to incentivize nurses to precept new employees and students, and they are wanting to give a $2,000 tax credit for 200 hours of precepting. So they are trying to get that passed to help incentivize people to precept. Many organizations also incentivize precepting. The second thing that I noticed is in August, one of our Iowa representatives introduced a bipartisan bill to assist with grant funding to help open up LPN to RN transitions and to get experienced nurses into teaching roles. And so it's called Training More Nurses Act. And so they are trying to free up grants to funnel that into how can we close the gap of not having enough nurses at the bedside, but also not having enough nurses in our collegiate roles.
Definitely, I agree with you, right? Faculty development and funding is so important, and that has a lot to do with the legislature. But I think some of our clinical partners across the board are doing innovative things within the hospital setting, using technology, such as having a virtual nurse that can look in on, on the patient and have conversation with the patient while the nurse have the time to meet the other needs of the other patient. So innovative things like this. And I know there's more to come, especially with AI, right? And how that can be used. So I think there are innovative solutions that are coming, and some of them will have some policies enacted to ensure that they are sustainable, but I think it's going to take a collaboration between not only the hospital setting, but also academia and state.
I know I'm not a panelist, but I need to add something small. I think the state of Florida is doing a great job with pipeline funds, and for the past few years, the nursing profession has received $40 million. Is that what it is? $40 million. And based on your success metrics of your school, you receive a part of that. And State College of Florida nursing program has always been part of that because we have a very successful group of students moving out. The other thing that excites me more, though, is we have clinical partners who become line funders, and that's called Linking Industry to Nursing Education. So that line funder or that organization will donate money, and then the state matches it. So there's two really important funds that's coming through the nursing, through nursing, so that we can do things for our students, like purchase things for our students that help them to be more successful. So if you're ever wondering where I get all that money, that's where I get all that money. So I just needed to add that, but thank you very much. Okay, I think we're on number 5. Okay, given the growing concern about nurse burnout and retention, what are some successful examples of flexible scheduling and staffing practices that have been implemented to ease nursing workloads?
So I can start on this one. There are a lot of programs that can be done. We have weekend-only programs or split shift type of programs. There are so many things that we can do. But one of the things that I think is so important, and when we talk to employee groups and nurse groups, having the support that they need to be able to do their jobs. So having technicians who can help, CNAs, that kind of thing. Anytime I talk to nurses, that's one of the things that they really want that we never seem to have enough of. So how do we get that support, having those techs, having those CNAs? I always encourage people, our nurse students, when they're in school to become nurse techs, not to work full-time, don't worry, Tammy. But to have sometimes a per diem where you go once a week or once every couple of weeks. I love it for a couple reasons, because I think it's very important to learn some of those basics of nursing, because if you don't have one, you're going to be the one that does those things, the vitals, the baths, those kind of things. So actually 3 reasons. So it provides those nurse techs and support. It gives you experience in the hospital. You determine whether it's a good fit for you and them. When you transition to being a nurse in that same hospital, you've got that familiarity. I think it's a really great way to do it. I think it provides the support for the nursing staff. I think it's just a really great way to go. So I always encourage that. Please don't do it full time. It's way too much to do that while you're a student. But I think it's a really great way to get exposure and to learn a lot of the things and for the things to become more routine for you, but also to support the nurses. I think it also helps nurses have a little bit of empathy for the people that are supporting them. Because if you've done the job before, you know it can be a very tough job. And you want to treat those people well because you want them to stay there with you. So I think those are a few things that we can do for that sustainability and to really help with the burnout and to have options.
I know, oftentimes scheduling is variability, but in regards to the workload of the nurse, many times organizations try very hard to offset many things that take a lot of the nurse's time. Many times you'll see an admission nurse or a discharge nurse, someone who's coming to make sure when the patient's ready for discharge, they come up and grab the patient once you put the notification in, and they'll come and bring your patient down. A lot of times we'll have guest services be able to come and round on a patient to make sure that everything is okay. If there's any kind of service recovery that has to happen with your patients, they come up and can give a little bit more TLC to your patients. There's several things that happen that they're trying to alleviate some of the workload off of the bedside nurse so that you can get, back to the care of the patient.
I guess I can speak to the burnout and retention concerns. From my experience, I think, we are better than where we were since COVID. So that is a very positive way to look at it. And I think that what nurses have highlighted was, I need you to hear me. And I think our hospital partners have done that. You know, open up their ears to hear what nurses need. But as a nurse myself, I think we also have a responsibility to ensure that we make sure that we take that time in our personal lives to fill our cup so that when we go to work, we're able to pour into the people that need it the most, right? And when we go back home, we need to fill it back up again. All right, so make sure you take time for you. That's very important because that's kind of one of the ingredients in making sure you don't burn out, which leads to retention problems.
Absolutely. I agree 100% about the take time for you. That's very important. Did everyone hear that one as my new student? Okay, very good. So number 6, with nursing education evolving rapidly, how can we ensure that new nurses are held to a high standard of ongoing education and are provided with the necessary mentorship to handle the complex challenges they may face in practice?
I can start. I think there are several transition programs that help nurses or new nurses transition to the clinical environment. I mean, those externship programs are getting longer and longer. But I think it starts way before that. It starts within the collegiate environment, where we are training the nurses, making sure that they're trained well, making sure that they have the proper clinical experience so that when they come to our hospitals, that when we're mentoring them, we're not teaching them what they should know, right? Because that kind of set a high level of stress, not only for the student, the preceptors, and the organization. So I will let you guys add more. I hope I started something.
For what I think is, you know, education is always ongoing. So oftentimes when you start a new organization, a lot of your onboarding and education is very much front-loaded. But your first year, like I said before, is a blur. Many organizations have what they consider as a clinical ladder, where different educational opportunities are afforded to you, different projects, things like you have to complete to advance. But in my organization, we just recently started something called the Clinical Advancement Program, where many, many activities are included in this program that you pick which one you want to do, which one fits with something that you're passionate about. And each activity is incentivized. And every 6 months, you know, they can make up to $2,500. And so that makes a big difference when the extra time that you spend pouring into yourself, pouring into your organization, means something and actually can help you afford other things. So I know that it's not always about money, but in the grand scheme of things, money does incentivize a lot of things. So.
Absolutely, that does. I have to add, I'm always adding information, aren't I? I just have to tell you, this last question was actually twofold. It was actually addressing nursing education programs, and it was addressing the hospitals with a mentorship program. So it is our duty as educators and as programs of nursing to do our very best to make sure we're giving our students all the opportunity to be the best nurse they can be, so that we're giving our community the best. And that's what we're trying to do here at State College, so hopefully you'll agree with me. Yeah? Okay, very good. So while I'm looking at Judy here real quick, could you share with everybody where you went to school?
I went to SCF, but when I went here, it was Manatee Junior College. So it was many, many, many years ago, and I got my AS in nursing here. Well, not here, because here was a cow pasture back then.
Oh, dear.
But yeah, so many years ago, it gave me a really great start to my career. I told them before we started here today, I didn't get my BSN because I was not going to have anything to do with management, I didn't want to be a manager. I just wanted to be a nurse. I was never going to be able to manage people or anything like that. I wanted to take care of people, and that was it. So so I was very happy doing that for several years, and I grew from there. But coming to SCF really gave me a great start on my career. I felt like I was prepared to be a nurse when I was here. It's always a big transition when you go from being a student to being the nurse practicing. And I worked for a year on an orthopedic floor, and then I went to surgery for most of my clinical career. But I felt very ready, and don't feel bad when you get out and you're like, what am I doing? I don't know what to do. You've got a great start. You've got the base knowledge. I'm here to say it. It was actually in the 80s, but I know they probably advanced a little bit since then too. So yeah, it's been good, and it's really great to be able to connect and be able to talk to people about my experiences here as well.
We always bring, Judy's part of our advisory board, so we always bring her back in every June just to connect and make sure we're doing what we need to do as a program. So it's really nice to have alumni in management roles and leadership roles out in our clinical partners. So thank you.
You're welcome.
Okay, back to the next question. Sorry, I diverged. How can healthcare systems better integrate simulation training, mentorship programs, and peer reviews to support newly graduated nurses in reducing the occurrence of medical errors?
I can start this one. Peer review is so powerful, especially as a new nurse, because in many ways you are learning all of the steps to be a safe practitioner. And as you know, there are many steps to each thing that you do, whether it's hanging IV fluids or whether it's administering something IV push. There are so many steps and so many things to be mindful of. Peer review really, for lack of a better phrase, peels the onion on a shift in an expected outcome of care. So if you have an incident that occurs within your organization, the ideal thing is to really look at it, to really peel away where did we deviate from a process? Where could we have done something different, supported a practice differently? You find out so much about how errors are made and how they are created, and they are so multifaceted. There's so many times where errors all boil down to communication and the absence of or the missed opportunities for communicating things. And as a new nurse, that is exceptional information to put into your practice, is how could I do better? How could they have done better? And it's part of learning is trying to look at your mistakes or someone else's mistakes and learn from them.
And just to add to, I think simulation kind of connect to what you just saying about the errors. Simulation is there for you to be able to simulate a real experience. And what that means is that is the ground where if you make a mistake, it gives you the opportunity to first not kill anyone, right? Second, it gives you the opportunity to learn from it, right? Where you can debrief and prepare. So simulation is very important in nursing education, and I don't think we'll ever be able to get away from it. And as we know, things are are improving every day to make it real. And not only are you going to experience simulation in school, but simulation is experienced as they prepare you in the hospital. So that's something you will always see. So simulation has a lot to do with that, and will continue.
Yeah, and it's important to make sure when you do make an error, and you will, don't ever, it happens to everyone. We all remember ours, I'm sure. And make sure that you're talking through it with somebody that you know or trust or whoever, because psychologically, it's hard. And we have to be able to admit it, and there's nothing you can do about what happened in the past. It's what you can do in the future to have a safer practice. So always, you've got to admit it when it happens and talk to someone, try to talk through it. Like she said, peel back the onion, try to figure it out so that it doesn't happen again. So it's really, really important to do that. And then in hospitals, a lot of the time we turn to what we call just culture algorithms. If somebody made a true error, they didn't know what the policy was, they did whatever they did in good faith, then we need to really re-educate and help them learn how to do it better in the future. It's not the same as you knew you should have done it a different way, you had a safety process and you decided not to. So I think we have a responsibility as hospitals to make sure that you feel supported in those errors, because nobody can be harder on you than you're going to be hard on yourself.
Absolutely. I think we all remember our first error.
Oh, yes.
It was terrible. It was awful.
Yes.
But you'll remember it too, and you'll never do that again.
Yep.
But, okay, I have some great questions from students, so I'm going to push through these a little bit to get to those. Given the growing demand for nurses in Florida and the ongoing workforce shortages, what strategies do you believe are most effective in bridging the gap between nursing education and sustainable career placement, particularly in retaining new graduates and supporting their transition from classroom to clinical practice?
So one of the things that we've started to do is using a different model for the transition when you come to practice at hospitals. I know we've done it in a couple of my hospitals. So we used to say, okay, first you're going to take one patient and do everything for them, and then we're going to add a patient, and then you're going to go to 2, and then 3, and then 4, and then 5. By the time you get to 5, you're like, there's no way I can do this. This is way too much. I can't, this is a whole patient load. So what we've started to look at as, you're with a nurse, you're going to take all of their 5 patients that they have on a med-surg unit, and we're going to add tasks or different parts of the job that you do. So this week, I'm going to have all of the patients, but I'm going to do their assessments, and I'm going to document their assessments. And I'm going to do that for a week. And then next week, I'm going to have all 5 patients, and I'm going to add medications. So I'm going to do their assessments, and then I'm going to give their medications, so that you're adding those things along as you go along, so you don't have that, I just can't do it by the time you get to your 5th or 6th patient. You're picking up the skills as you go along, and I'm really excited about that. We had a lot of success with that at Lakewood Ranch, and I think that that's a really good model going forward. So I think that's a really great way to transition nurses into students to practicing.
Another strategy that FCN is pushing is called NCLEX now. So we work with the Florida Board of Nursing and alongside and figure out how we can get you to sit for the NCLEX as soon as possible and make the directions and everything clearer for you. Can you believe in the state of Florida, we produced 19,623 NCLEX first-time test takers? That was in 2024. Nearly 9% of the nation RN. So if we're looking at best practice strategies to bridge that gap, we need you to take the NCLEX now. And things are changing for the Florida Board of Nursing because they presented to us yesterday of how they're going to make it easier for you to apply. The other thing is your professional identity is so important as a nurse, right? Sometimes we think once we graduate, we will know what we want. We will be able to identify what specific arena that we're going to work in. Nursing is so vast. Don't stress yourself. Just open to receive, and you'll find where you belong, that professional identity. So I think those may help, especially when you are graduating, to actually finding a place where you belong in your career.
Okay, and our last question for the panel that's on my list. Looking ahead, what technological, regulatory, or procedural changes do you foresee having the most significant impact on nursing in the next 5 years? How can the profession proactively prepare for these shifts?
That was a long question.
Do you want me to do it again?
Please.
Okay. I'll slow down a little. Okay. Looking ahead at what technology, regulatory, or procedural changes do you foresee having the most significant impact on nursing in the next 5 years? And how can the profession proactively prepare for these shifts?
I can speak to technology, right? Technology is running a marathon, and we're just walking, right? AI is here, and AI is here to stay. So how can we utilize AI and medicine to best meet the needs of not only the patient, but also the workers, right? To alleviate some of those tasks. And I know that from the discussions I've attended, that many organizations are looking at ways, and they're partnering up with educational institutions to actually model those within their the practice environment. And I think that is going to be a major shift. And some will welcome it. All right, and some won't, because, we don't like change, but without change, there's no progress. So I think technology will definitely be one of the major shifts in the next 5 years for us.
Absolutely.
One thing that I think may be helpful in the collegiate environment is pulling in the ability to navigate massive amounts of information and data that is coming at you as a care provider. Because when you come out into practice, when you are in your clinicals and things like that, everything seems to be a bit more measured, a bit more safe and practiced. When you are out in practice by yourself and doing the job of being a nurse, you have a ton of information that is coming at you that you have to pull together and create a picture of what's going on with the patient. It varies, and it is really important to be able to multitask and pull all that together in a way that makes sense, that you can care for the patient appropriately, be able to have conversations with physicians, with family, with case management. So I think it would be wonderful if we were able to create some curriculum that helped our students with all of those multitasking pieces that they're going to experience in the setting that they're going to be working in. I think it might help give you a little bit of a leg up on what you're going to experience in the real world.
All right, thank you. So I just have to stop here and pause and talk about technology just a little bit more, and I think you know where I'm going. The National Council State Board of Nursing has on their website that they're considering allowing new graduates to take their NCLEX exam at home. Tell me a little bit about how you feel about that idea.
Frightened. What I have noticed is people are very opportunistic when it comes to leveraging technology, and my concern is it is not always for the greater good. And when you're trying to take a very important test, you may make some wrong decisions that if you're leveraging other things at home that you shouldn't be, it just might not have the outcomes that you're anticipating. And I think it's just kind of setting us up for failure. So don't think it's good.
When I first heard of it, I'm like, I don't know how that will work, right? And then I had the pleasure of speaking to the Florida Board of Nursing, and the leader of education was there as well. And the technology that has been introduced to actually allow them to stay home and take it is massive. It's not the regular technology that we have in the classroom. And I hear that technology can pick up a dot and sees everything. So it's going to be very interesting how that moves forward. As I know, when they graduate, sometimes they have to wait to get in to even take their tests because that is limited. So I'm always 50-50. I'm willing to embrace and do a small pilot. That's where best evidence come and see how that works and determine if it's worth the hassle. But I think we may have to open up a little bit and see how it's what the outcome's gonna be. But I hear the technology, guess what it comes with? It's very, very, very expensive. Yes.
Absolutely. Well, I see why you were the dean of St. Pete College for so many years. Wise woman. Do we have time for just a few more questions from the audience? Is everybody okay if we have a few? Okay. This is a really good one. I don't want to miss this one. So these are all surprises for you, ladies. Okay. How are we addressing safety in nursing, not only for patients, but for nurses? How are you addressing the work environment for emotional, physical, and mental safety? How are we improving the overall environment and creating the happy workspace?
So for safety overall, I think we've got to have a zero tolerance policy for that for nurses. We can't have horizontal violence. We can't have violence with our patients toward the nurses. I think Florida has been pretty strong on that. And I think we need to support our staff as those issues come up. It can't be tolerated. The physical violence is much easier to see than the psychological things that happen. But we have got to support each other. And when we see it, we've got to call it. I always say, if you permit it, you promote it. So we've got to address it when we see it, and it can't be tolerated.
The Florida Center for Nursing, they're doing several initiatives to address some of that. One of the one, and that was more than a year ago, was created the Wellness Advisory Committee that's working on finding different initiatives statewide, right, to address some of these things. And I think we're getting more into violence. We're glad that the statute, right, that went through, that if there is violence towards a nurse, that there must be action steps. And I think you guys all seen it in the news of, nurses been harmed, and no one wants to go into a profession where they know that their safety is at risk. So now there's legal things that can be done in regards to that. The other thing, when you talk about psychological aspect of being a nurse, I think we as nurses, and I'm talking as a psychiatric mental health nurse practitioner, there's no shame in seeking help. But many times we seek help when we are at our last straw. What strength is seeking help when you know something is not right. Whether it's through therapy, whether it's through going to see a psychiatrist, that's where you put yourself first. Psychological trauma, people cannot see it yet. It does not mean it doesn't exist. And I can speak because I was a pediatric intensive care nurse, and we also took care of cardiac, PICU, pediatric intensive cardiac unit. So you're talking about babies. I had to see that every day when it was not normal for me to see kids leaving the earth. So of course, as a human being, that's gonna have an impact. And I remember driving home from the ICU one day, and I had to pull my car over because I couldn't get this one patient out of my mind, and I just sobbed. And I know that after 4 to 5 years, it was time to make a shift. I didn't leave nursing, but that is the wonderful thing about nursing. If I tell you about my career trajectory, you're gonna be like, oh my gosh. But there's opportunities. You gotta take care of yourself. The mind controls the body. If the mind controls the heart, the lungs, and every organ in it, what makes you think it's not the most important thing to nurture? So that's where I'm going to leave that. Thank you.
I think as an organization, it's very important not to just think of any kind of unsafe situations or violence, within your workplace as singular events, that yes, things may happen, but then how do you prevent it moving forward? Many organizations not only identify an event that has occurred, but then many times they identify that patient moving forward so that any caregiver that may go into that room after that event has occurred that may have no idea that that event or that violence occurred previously is now forewarned to be more cognizant, have more safety, measures in place so that they're safer. And so, in my opinion, those are things that we're trying to help, spread, because it's not just nurses who care for patients. It's a transporter, it's a phlebotomist, it's your environmental service, technician who comes in to change, the trash, who a patient may become violent with, and they had no idea that something occurred before. So everyone in a care facility can be impacted, and so you have to keep everyone safe.
And would you guys say that there's more safety training now? Yeah, more safety training within the hospital setting, not only how to protect yourself, but also, protect the patient as well, right?
Yeah, there are even behavioral response teams. So a lot of hospitals have rapid response teams. Most everybody does for medical issues, but sometimes there are behavioral issues that happen where, some people call security alerts and 50 people come running, and most of them are just there to watch. And sometimes it escalates the situation a lot more than it needed to be. So if you have behavioral response teams, you have people who are trained to deal with those situations. There's only a handful of people that come and they work together to deal with the situation at hand right now, but also what is the plan moving forward. And those are really great teams to have so that you can deal with those situations in a productive manner.
Absolutely. And I, of course, have to add something. You know me, Judy. I think it starts in nursing school. I think it starts us teaching you how to be advocates for yourself. And I know everybody here has been to simulation, the psychological safety of simulation. And when you feel that you're not safe from a mental health or a psychological perspective, you advocate for yourself. And I've seen that. I've seen it this week, and I'm very, very proud of my nurses, my student nurses. You're doing a great job, so thank you. Okay, just a few more. I have to read this one. I'm pretty sure it's to you, Judy. Wait, glasses on. This is not a question. I would like to say thank you so much for giving us a chance to do clinicals at your facility. This opportunity gives us a chance to do patient care and to put together the lecture with the hands-on experience.
Nice.
Yeah.
Thank you.
I have lovely students.
Thank you.
Okay, 3 more quick questions. Is there going to be any new clinical sites opening for students? I did not plant this. Right. I did not plant that question. It's probably not for you, maybe for both of you.
We have a lot of clinical going on.
The door is always open.
Perfect.
I
Good
think
answer.
it just depends on how far you want to travel.
Hey, we could do an overnight in Orlando and visit a
Right.
park. Yes.
We seem to be building a lot of hospitals, and we actually even have one in Puerto Rico. So if you want to go to Puerto Rico to do clinicals, we could probably help facilitate that.
That would be so cool.
Puerto Rico.
Me
to go
too.
do clinicals.
Yes.
Do it.
We'll start all over again.
Well, we have a dual language program, so we might. Yes, absolutely. Okay, last 2. With nurse-to-patient ratios being a concern for most nurses, what is being done to ensure safe ratios are maintained?
So in our situation, I think with the few hospitals that I've worked at recently, I think the ratios aren't, the stated ratios typically aren't the issue. It's having nurses to fill those ratios. So I think most of us have reasonable ratios. It's being able to fill those and having enough nurses to come into the facility. So it kind of just is the big circle of, getting more students into nursing school and being able to get them graduated and taking the NCLEX now so that we can get them started. And unfortunately, what it leads to sometimes is nurses being frustrated, and then they decide to leave the facility that they're at, which perpetuates the problem. It's just a vicious cycle. So we've got to get everything firing on all cylinders to be able to make sure that we have those ratios. So I feel comfortable with the ratios that we currently have for safety, but sometimes you're working outside of those ratios because you don't have the people to fill them. I think a lot of the time people think, well, that's the hospital administration trying to save money or that kind of thing. It's not that. We want you to have the ratios that you should have so that you will stay at our facility, so that we don't have the turnover, so that people are happy where they're working. It benefits all of us to have those ratios that we want to have and as they are stated. So please know that your hospital administrators and leaders really want the same.
All right. So last question, what is the biggest barrier you are seeing out in practice that new nurses experience right after graduation? Great question.
I'll say, I think a lot of the time it's time management, and that just comes with repetition. So don't be frustrated with yourselves if you experience that. You can only do the best you can do throughout the day. Sometimes you've got to make up for it and do some documentation at the end of the shift, but the patient always comes first. And if you've got the patient at the forefront of your mind with everything you do, you're going to make the right decisions. You've got to learn to prioritize. You're not going to have time for every single thing you want to do for your patients every single day. So what are the things that you have to do? And make sure that you prioritize those. But I think time management and just getting into the routines and knowing the policies and the protocols and how you do this and how you do that. For me, starting a new job within the past 8 weeks, I was just talking before we started, it's learning, where the bathroom is, where the cafeteria is. Oh, wait, I've got to take care of a patient. I need to give them medications. It's all of those things all at once. And I don't know my peers and I don't know the doctors. All of those things come with time. So be patient with yourself. Give yourself forgiveness. It's going to be okay. You just have to hang in there. It's about a year and you'll start feeling like you're getting your feet under you, but just know we all go through it. I'm going through it. I've been a nurse for over 38 years. And every time I start something new, I think, oh, wow, it's have confidence in yourself that you can do it and you can get through it, and give yourself some grace.
I agree with you. Give yourself grace. And I sat here thinking, okay, when I was at USF, our graduate nursing school, what was my biggest challenge? What challenge I have observed as dean? But I think in 2025, things have changed for nursing, where it also was a struggle between the clinical work and the administrative task. Mm-hmm. And I think that as more paperwork became part of the routine, it's different now. There's more of it, right? So it's hard for you to balance, and that's why it's so important for you to give yourself that grace, because it can be done. Mm-hmm. And I think you eloquently stated about time management. Mm-hmm. Those kind of tools that you learn while you were in clinicals, right? Don't throw them to the side because you got a job. Mm-hmm. This is where you want to implement them so you could practice, so they could become habits.
For me, I get this question often in interviews. The most important thing that you can focus on is your ability to take care of yourself. When you work, you are pouring in to your patients, to your management, to your everyone around you. It is a very outward type of job. When you leave your job, you have to restore yourself, whether that is good sleep, good nutrition. What do you do to fill your cup? Is it your animal at home? Is it, a hot shower? Is it long walks? Is it going out with friends? You must maintain that with rigor, because that is what feeds you, and that is what is going to help you maintain your resilience. When you don't surround yourself with the things that fill you back up, your battery continues to lower and lower and lower, and then you start to feel those feelings of being overwhelmed much faster, being frustrated much faster, getting sick faster, calling in and those things, because you're not purposefully filling yourself back up. And it is a very slippery slope. So I really advise you to pursue that with fervor and rigor. So that was mine.
Great answers. Thank you. So as we close, I would like to once again thank our Level 1 and Level 4 students for being engaged and open to learning from today's discussion, and your questions were amazing. To our panel members, thank you for generously sharing your expertise and experience. And just with a parting thought from me, and I think someone else needs to talk as well, let us leave here encouraged, inspired, and ready to put today's insights into action.
Well, thank you all for coming today. We appreciate you coming out. Thank you to the panelists. Thank you to our moderators. Thank you to our gracious host at SCF. It takes a lot to put on these programs, facilities, IT, security. Thanks to our team for helping us out too. We have a couple slides here. Congressman Bill Young was kind of our visionary behind the Institute. We hope you can check out his documentary that we produced. Weaves his history and our history together. And take a look, scan that QR code. We also have several programs coming up. These are all hybrid, so you can view them online. We have next week's up in Jacksonville on autonomous vehicles. Then we have a 3D printing program at Tarpon Springs in Pinellas County. And then we're closing out the semester with our grand debate with students debating the First Amendment. So we're excited for that. Thank you also to Orlando Health, always being a supporter, serving on the panel, and supporting the Institute. And then lastly, we have food for everybody in room 135. So hope you can join us and continue the conversation. Thanks, everybody.